Hi guys, welcome to Didactics Online. I'm Rob, and I'm here with Megan, and today we're going to talk about lumbar HVLA. Okay, so I've already diagnosed Megan's lumbars 1 through 5 as neutral, rotated left, side bent right. So go ahead and line your left side for me, Megan. Now, there's two ways you can do lumbar HVLA with the lumbar roll. We've got this spine here so we can show you guys how to line up what's called transverse process up or transverse process side down for the lumbar roll. So we know that she's rotated to the left, and if you look at the transverse process, this basically means it looks like this. It's more superficial on the left, and we're calling this transverse side down. Now the difference between transverse side up would be if I have her in this position and her lumbars are rotated to the right. So this is what she would look like. Now, what this means as far as the treatment is where we're going to localize force. So she's got a good neutral segment from L1 to L5. I'm going to monitor right at the middle of it at a good L3 position. Now we're going to flex up to right at the area where it's transverse side down from the legs up to L3. I'm going to use her upper torso and actually pass L3 and bring all of my tension right below it. Where that differs is if she were rotated right and it would be transverse up, from the bottom I would flex her up through the segment to right above the joint, so I get that involved in the rotation as well. And then her upper half, I would just rotate her down to the segment we're monitoring it. It gets a little confusing. All you really have to remember is it's up to or down through, and that's all of your force. It's either above or below depending on how the transverse process is located. So the next, you really have to focus on fine-tuning all of your mechanics for the actual treatment. So you can fall off of the iliac crest, find L4 and 5, and then you can go up to 3. This is where you're going to monitor. I'm going to flex both of Megan's legs up till I feel motion just at that segment. Then I'm going to have her straighten her bottom leg. I can hook this foot in the popliteal fossa and switch hands. I'm still monitoring the same spot, and now I'm going to rotate her nice and gently without her help until I pass the segment. All of my tension is right below because we're doing that transverse side down localizing. I'm going to use my forearm right here on the back of her gluteal muscles, not on the greater trochanter. It can be a little bit painful there, especially if you have bursitis. So this is going to be where you get all of the thrust. My opposite arm is going to really monitor in the pectoral fossa. I'm not really going to push on her shoulder. You want to definitely make sure you're not on a female's breast. It's just really for monitoring. Now I have to bring these tissues as tight as possible to get a good HVLA correction. So with my left arm as my thrusting arm on the gluteal muscles, I'm going to pull her towards me as far as I can. Bring her nice and direct while I monitor with my opposite arm. I have my partner take a deep breath in, breathe all the way out, and I tighten the barrier and give one final thrust. Piece of cake. I heard a couple ago. I know we got a good correction. Can you line your stomach? The final thing you always want to do, make sure you recheck. Much better. All right, thanks for joining us. We'll see you next time on Didactics Online.